Imagine you're about to lose access to a life-changing treatment for your child. How would you feel? Probably terrified. Data from the Phase 2 ARCADE study of Soticlestat showed a decrease in seizure frequency in patients with CDKL5 deficiency disorder. Let us show you.
Before Soticlestat, she was in a vegetable-like state with no intentional movements and had lost all skills. She could not eat or drink by mouth and required G-tube placement. I didn't know if she would even survive another year. She began smiling within a month of being on Soticlestat. Shortly after, she began sitting with assistance. 5 years later, she is now sitting unassisted, standing almost unassisted, and taking steps with assistance. She horseback rides 3 times a week with minimal assistance as well. Her brain has developed for 5 years with Soticlestat on board. If she cannot continue the medication, I think seizures will take over and she will lose all the skills she's gained and go back to that near vegetative state of life. I don't know if she will even live long if we remove the drug.
Before Soticlestat, she was often sleepy, having 1 to 3 seizures a day. Alertness was always a challenge. She didn't sleep well at night. She was severely delayed in all areas. Since Soticlestat, her cognition is greatly improved. She is making great strides with her communication device. She can advocate for her brief to be changed, pick what she wants to do, and request what she'd like to eat. She is only having 1 to 2 seizures a week now. This medication has greatly improved her quality of life. In 17 years of trying seizure meds, this one has been the best, not only for seizures, but for cognition and communication. We worry that she will lose these new skills if she must come off this medication. We also worry that seizures will increase and her alertness will suffer.
Before Soticlestat, seizures were completely dominating his life. It seemed that all he did was seize and sleep. He couldn't hold his head up and wasn't alert enough to eat, so he got a feeding tube. He struggled to breathe. I wasn't sure he would live to be 5 years old. Soticlestat was a miracle for my son. His seizures greatly reduced, and we were able to wean extraneous meds away. Suddenly, he no longer needed oxygen and suctioning. He was able to actively participate in therapies. I'm kept up at night with worry about what might happen to my son if he has to wean this medication away. He's been on it for more than half of his life. Before, I wasn't able to leave the house with him on my own because we had to bring so many tools to help him stay safe. I don't have help caring for him. The thought of going back to how he was before makes me physically sick to my stomach. I don't think he'd survive.
Prior to starting Soticlestat, we were basically out of drug options, and she was on high doses of some powerful drugs. She always had huge dark circles under her eyes. We were administering rescue meds at least monthly. We have not used a rescue medicine since starting Soticlestat. We have also weaned the powerful drugs she had been on. She has gained motor skills, and we've seen a significant decrease in sensory behaviors. I am worried that she will revert back to uncontrollable vocal stimming and other sensory behaviors. If this happens, she will lose meaningful access to the community. I also fear the loss of motor skills that help her participate in her activities of daily living and reduce caregiver burden. Obviously, a return to unmanageable seizures and frequent rescue med use would be awful.
Before starting Soticlestat, she was having 8 to 10 seizures a day. She had very little strength, was unable to hold her head up, and feeding was a challenge. She needed all her food thickened. We were only focusing on 1 day at a time. Soticlestat has been life-changing. Seizures reduced to 1 to 2 a week, and she is alert and present. She is now sitting almost independently, standing with support and taking assisted steps. She is eating semi-solids and not needing thickened fluids. She even has a few functional words. We can't imagine our daughter having to wean off Soticlestat. We believe the risk of seizures coming back is very high. With their return, we are afraid that she will lose all the skills she has gained. We will be without any solution.
Before Soticlestat, Samantha's days were continually disrupted by large seizure events, as long as 10 to 12 minutes each. We were using rectal rescue medicine multiple times a month. She had severe autonomic issues and petechia, or broken capillaries, all over her body with every seizure. With Soticlestat, her seizures are decreased in intensity and duration, and she regularly goes 2 weeks or more seizure-free. Her engagement has increased and her motor and communication skills have improved. She has many days full of happiness, laughter, and smiles. If we need to wean this medication, I am worried that the long seizures of before will return. I worry that they will interrupt her ability to learn from and enjoy her environment. The loss of her quality of life would be a true tragedy.
Of the 10 CDKL5 patients who completed the arcade study, 8 of us are still on the medication years later. We know this medication works, so what's the problem? No one is looking at our data. If no one looks at the data, they cannot see in black and white what our families see in color every day. This medication works. We don't want to wean. We are terrified to wean. We need to keep Soticlestat alive, not only for our children, but so that others in our CDKL5 community can also have the opportunity to try this medication. Can you help us?